Have Victorian Premier Daniel Andrews and Health Minister Jenny McCarthy providing a coronavirus update from the State Control Centre in Melbourne. Let's take a look.
Schools, prisons, hospitals, every part of our public sector and every part of the way people live their lives, really, from public transport all the way through to those critical health services that we will need. The central coordination of our response is very important. We've learnt that many times in many different circumstances. So Andrew will speak to that and give you a clear understanding of what his role under the relevant acts will be. But as you can see, the State Control Centre is up and running. This will be the central coordination point for our COVID-19 response, not just public health messaging, but the way government and the public sector and all of our partners respond. And I think that's just a common sense way of making sure that we've got clear messaging and the most efficient response to what is a dynamic and changing set of circumstances. I did also just want to make the point that the clinics that we spoke about yesterday, those testing facilities at 7 additional hospitals, are now up and running. Additional staff on the hotline, which we foreshadowed, are now in place. Each of the things that we foreshadowed yesterday have been done, and indeed many, many more. It remains the case that we can with certainty foreshadow extreme and widespread disruption, big challenges for our economy, for schools, for workplaces, for major events, but it remains the case that that is not now. The time for that will be at some time in the medium term. It's not a matter of panic or wanting to scare people, it's simply being as honest and upfront as we can be. But there's no change in terms of the status or the phase that we are in. We're still in that containment phase. Testing continues, containment continues, but it is, as I said yesterday, not a matter of if, but a matter of when we move from that phase to a pandemic with all of those very, very disruptive actions and interventions that we will need to take. Can I, on behalf of the government and all of our partners, and particularly emergency services and our health system, thank everybody who's working very hard to provide the best support to those who need it and to be ready for what will be a very big influx of patients and a very stressful time for many. Can I also thank the Victorian community for employing common sense, for listening to those messages, for being informed, and the many people who find themselves at home doing the right thing by those who are more vulnerable. It is very disruptive. No one wants to be locked away at home for a period of time, but that is the smart thing and the right thing to do to protect those in the community who've got underlying conditions and who, without that approach, could be gravely ill. Beyond that, can I just also add that I'm very pleased that the Commonwealth Government has made some significant announcements in terms of additional primary care support. Those fever clinics, the Health Minister will speak a little bit more about that, but some of the details will come to us as the day unfolds. These announcements have only been made overnight, or at least very early this morning, but we're working closely with the Commonwealth Government. Now's the time to come together and to be very focused on what needs to be done, and any additional support from the Commonwealth, particularly for primary care, is very, very important and much welcomed by us.